All right, so let's dive right into our first topic, which is understanding the various causes and risk factors of pneumonia. Pneumonia is a serious lung infection that can be caused by different types of microorganisms, including bacteria, viruses, and fungi. Now let's break it down and look at each of these causes in more detail. First, we have bacterial pneumonia. This is the most common type and is often caused by a bacterium called Streptococcus pneumoniae. Other bacteria, such as Haemophilus influenzae and Staphylococcus aureus, can also cause pneumonia. Next, we have viral pneumonia, which is typically caused by respiratory viruses, such as the influenza virus, commonly known as the flu, or the respiratory syncytial virus, RSV. Viral pneumonia usually tends to be milder than bacterial pneumonia, but it can still be quite serious, especially for young children and older adults. Lastly, we have fungal pneumonia, which is less common and usually affects people with weakened immune systems, such as those with HIV, AIDS, or cancer patients undergoing chemotherapy. Fungal pneumonia can be caused by various types of fungi, including those found in soil, bird droppings, and certain types of mold. Now that we've covered the different types of pneumonia, let's discuss some of the risk factors that increase the likelihood of developing this infection. Some common predisposing factors include age. Infants, young children, and older adults are more susceptible to pneumonia due to their weaker immune systems. 2. Weakened immune system. People with weakened immune systems, such as those with HIV/AIDS, cancer patients undergoing chemotherapy, or those taking immune-suppressing medications, are at a higher risk of developing pneumonia. Chronic lung diseases. Individuals with chronic lung conditions such as asthma, chronic obstructive pulmonary disease, COPD, or cystic fibrosis are more prone to pneumonia as their lungs are already compromised and more susceptible. So, to sum it up, pneumonia can be caused by various types of microorganisms, including bacteria, viruses, and fungi. It's essential to be aware of the risk factors such as age, a weakened immune system, and chronic lung diseases that can make you more susceptible to this serious lung infection. Moving on to our second topic, let's discuss the common signs and symptoms of pneumonia and learn when it's time to seek medical attention for proper diagnosis and treatment. Recognizing these symptoms early on is crucial, as timely intervention can make a significant difference in the outcome and recovery from this serious lung infection. Some of the most common signs and symptoms of pneumonia include 1. Fever. A high temperature is often one of the first indicators of pneumonia, as the body tries to fight off the infection. So, cough. A persistent cough, which may produce mucus or phlegm, is another common symptom. The color of mucus can vary from clear to yellow, green, or even blood-tinged. 3. Shortness of breath. Breathing difficulties can occur in pneumonia due to the inflammation and fluid buildup in the lungs, making it harder for oxygen to reach the bloodstream. 4. Chest pain. Sharp or stabbing chest pain that worsens when you breathe deeply or cough can be a sign of pneumonia. This pain is usually a result of the inflamed lung tissue and the pleura, the membrane that covers the lungs. 5. Additional symptoms. Other possible symptoms may include fatigue, weakness, loss of appetite, nausea, vomiting, and confusion, especially in older adults. Now, when should you seek medical attention? If you or someone you know is experiencing any combination of these symptoms, especially if they are severe or persistent, it's essential to consult a healthcare professional. Early diagnosis and treatment can significantly improve the chances of recovery and reduce the risk of complications. Remember, pneumonia can be a life-threatening condition, particularly for infants, young children, older adults, and individuals with weakened immune systems or chronic lung diseases. So don't hesitate to seek medical help if you suspect pneumonia. Now that we've covered the symptoms of pneumonia, let's explore our third topic, which is the different diagnostic tools and tests used to identify pneumonia. When you visit a healthcare professional with suspected pneumonia, they will likely use a combination of these methods to confirm the diagnosis and determine the severity of the infection. 1. Physical examination. The doctor will start by listening to your lungs with a stethoscope to check for any abnormal sounds, such as crackling, wheezing, or decreased breath sounds. They will also assess your overall appearance, breathing rate, and heart rate. 1. Chest X-ray. This imaging test is often used to confirm pneumonia and can reveal the location and extent of the infection in your lungs. It can also help rule out other possible lung conditions, such as a collapsed lung or a tumor. 1. 2. Blood tests. Blood samples may be taken to check for signs of infection, such as an elevated white blood cell count, and to determine how well your body is fighting the infection. In some cases, blood tests can also help identify the specific organism causing the pneumonia. 4. Sputum culture. A sample of your mucus or phlegm may be taken and sent to a laboratory for further analysis. This test can help identify the specific type of bacteria, virus, or fungus causing the pneumonia and guide the doctor in choosing the most effective treatment. 5. Additional tests. Depending on your specific situation and risk factors, your doctor may also recommend other tests if they're Sindings or certified or bronch. In conclusion, diagnosing pneumonia involves a combination of physical examination, imaging tests, and laboratory analysis. Identifying the cause of the infection is crucial for determining the most appropriate treatment plan and ensuring a successful recovery. So if you're experiencing symptoms that could indicate pneumonia, be sure to consult a healthcare professional for a thorough evaluation. All right, let's move on to our fourth topic, which is exploring the various treatment options for pneumonia. Once a healthcare professional has diagnosed you with pneumonia and identified the cause, they will prescribe a treatment plan tailored to your specific needs. The type of treatment will depend on the severity of the infection and the organism causing it. 1. Just antibiotics. If your pneumonia is caused by a bacterial infection, your doctor will prescribe antibiotics. The specific type of antibiotic will depend on the bacteria responsible for the infection, as well as your overall health and potential allergies. It's crucial to complete the full course of antibiotics as prescribed, even if you start to feel better before the medication is finished, to ensure the infection is completely cleared. 2. Medications are sought through antiviral medications. For viral pneumonia, antiviral medications may be prescribed, especially if the infection is caused by the influenza virus. These medications can help shorten the duration and severity of the illness. Similar to antibiotics, it's essential to follow the prescribed treatment plan to ensure the best possible outcome. 3. Supportive care measures. In addition to medication, supportive care measures can help manage symptoms and aid recovery. These may include over-the-counter pain relievers and fever reducers such as acetaminophen or ibuprofen to help alleviate fever and pain. Drinking plenty of fluids to stay hydrated and help thin mucus, making it easier to cough up. Getting plenty of rest to allow your body to focus on fighting the infection. Using a humidifier or inhaling steam to help relieve congestion and ease breathing. 4. So, in more severe cases, or if you are at a higher risk due to age, weakened immune system, or chronic lung diseases, you may require hospitalization. And this allows for close monitoring and the administration of intravenous antibiotics, oxygen therapy, or even mechanical ventilation if necessary. The importance of early intervention and adhering to prescribed treatment plans cannot be overstated. Prompt diagnosis and treatment can significantly improve your chances of recovery and reduce the risk of complications. So always follow your healthcare professionals' recommendations and reach out to them if you have any concerns or questions about your... Now, let's discuss our 5th and final topic, which is studying prevention strategies for pneumonia. While pneumonia can be a serious and potentially life-threatening condition, there are several measures you can take to minimize your risk of infection and complications. Let's go through some of these key strategies. 1. Vaccination. Vaccines play a crucial role in preventing pneumonia caused by certain bacteria and viruses. The pneumococcal vaccine helps protect against Streptococcus pneumoniae, while the seasonal flu vaccine can reduce the risk of pneumonia caused by the influenza virus. It's important to keep up to date with your vaccinations and follow your healthcare professionals' recommendations, especially if you fall into a high-risk category, such as young children, older adults, or those with weakened immune systems. 2. Proper hand hygiene. Washing your hands regularly and thoroughly with soap and water is one of the most effective ways to prevent the spread of pneumonia-causing germs. If soap and water are not available, using an alcohol-based hand sanitizer can also be helpful. Remember to practice good hand hygiene, especially before eating, after using the restroom, and after coming into contact with someone who is sick. 3. Maintaining a healthy lifestyle. A strong immune system is essential for fighting off infections, including pneumonia. To keep your immune system in top shape, make sure to eat a balanced diet rich in fruits, vegetables, and whole grains. Get regular exercise, aiming for at least 150 minutes of moderate intensity activity per week. Maintain a healthy weight, as obesity can weaken the immune system and increase the risk of respiratory infections. Get enough sleep, aiming for 7 to 9 hours per night for adults. Manage stress, as chronic stress can weaken your immune system and make you more susceptible to infections. 4. Avoid smoking and limit exposure to air pollution. Smoking damages your lungs and makes you more prone to respiratory infections, including pneumonia. If you smoke, quitting is one of the best things you can do for your lung health. Additionally, try to minimize your exposure to air pollution by staying indoors on high pollution days and using air purifiers if necessary. In conclusion, pneumonia prevention strategies include vaccination, proper hand hygiene, maintaining a healthy lifestyle, and avoiding lung irritants like cigarette smoke and air pollution. By following these tips, you can significantly reduce your risk of developing this serious lung infection and its potential complications. Stay informed and proactive in your health, and you'll be well equipped to ward off pneumonia and other respiratory illnesses.